19th, Minnesota Senate Human Services Committee, and we'll call this to order. Members, we have at least, I think there's 28 or so people that are signed up to talk today, and also in your packet, members, folks had sent letters, and I think it would be very important for us to have those. There's one that Cassie had put together, a bunch of them, everybody from the Minnesota First Provider Alliance to Ramsey County to Lutheran Social Services to the Multicultural Autism Action Network. There's a big, thick one, and then there's even one where a parent gave us a picture reminding us about why we do what we do. There's a picture of their son in there. And this today, of course, is our response as a committee just in what we heard. But really, it's the folks, our partners out there, our parents, and our providers, and to that, Senator Rasmussen.
Thank you, Mr. Chair, and I really appreciate you making the opportunity for folks from across the state to come down and share feedback on the proposal that we heard on Monday. And I think, Mr. Chair, that this committee should plan on just doing a lot of listening and hear from the folks that are directly impacted by the decisions that this committee and this legislature will be making in the coming weeks. And I'm really grateful in advance for all those who are taking the time to come here and participate, and look forward to hearing your feedback and stories. Thank you, Mr. Chair.
Thank you for that reminder, members. To Senator Rasmussen's point, I think this is a time for us to do some listening. And what I'll do is I have members, I put groups of chairs out there just because as we get down to the end, I'd like to really hear from the, when we get to the providers or our county folks. I've had those grouped. You can see that in your agenda sheet. Just you can see there's a light line in there, but I'll be calling up folks, I think, on that. And Senator Rasmussen, maybe, on the conversation with the counties that since you did your press conference today regarding the concerns, and it was honest feedback from the counties just about what does that mean, and I know one, Anoka County, Julie Jepson and Mike Gamache are here, the chair and a member, had said, it's anywhere between 7-9% of, the levy, and to hear Otter Tail County and to hear, folks talk about that. And that's real. Those are real services going out there. So it was good to hear that today. So I want to thank you for doing that. And even Senator Gruenhagen did a nice job. Kept them on track. I appreciate that, Glenn. I'm kidding. So with that, we're going to go, I think, members, first there's a Zoom. And if we could try to keep it to 3 minutes each, I will look at our time, even though the committee has said, we will take our time getting this done. I think if you can't get your message across in under 3 minutes, then maybe you should go, what's that program you study on how to give a speech where they count the ums and the ahs? I don't know. Somebody will remember what that is. But Aidel Abdul is on Zoom, and Anissa Haji Mohammed is also on Zoom. So let's start with there. And then while they're doing that, Wade Stuvey and Nathaniel Olson, you guys are in the crowd. You want to come on up and get seated at the table? That would be wonderful. So with that, Aidel, are you there?
Yes. Can you hear me, Mr. Chair?
I can barely hear you. Folks, can we turn that up, please?
I'll speak louder.
I love that. There you go. Nice to see you again.
Yeah, nice to see you. Good afternoon, Mr. Chairs and members. Thank you so much for the opportunity to be here today. I appreciate your time. My name is Aidel Abdul. I am a Somali autism mom and trying to retire advocate. Every year I try to retire. Let me start by telling you that I am disappointed by the governor's policy and budget proposals for autism. It seems that Governor Walz and the state Medicaid agency, DHS, have failed, again, the autism community. Here's why and how. Number one, we as autism families are being told to wait for years to put oversight and safety measures to protect children with autism. Why so long? DHS is a regulatory agency, has the power to do something now. They can train both autism families and agencies on EIDBI policies. In fact, we advocated for DHS to hire autism staff back when Governor Plenty was here with Dr. Sulik. I believe he hired one person. Now there are three. There's a clinical lead, there's a policy lead, and there's a trainer. And I put a little joke in there that a Saudi woman has seen more daylight and sun than them. They never come out and do actual in-person trainings or even online for anyone. If they are not doing what they're hired to do, but are still getting paid with public funds, then the governor should have proposed cutting their positions. The third one that I would like to address is that DHS can create a checklist for families and agencies to follow instead of complaining silly things like agencies don't have professional emails, or they don't understand this EIDBI statute. That's your problem, DHS. Train people and stop blaming us if we don't understand things. Train families, train providers, and hold everybody accountable if we're not following the statute. That's what the regulatory agency means. We have already advocated for background checks a few years ago with Abler and labeling, and there's actually really good required trainings for agencies and staff. The problem is DHS never follows up to make sure that it has been done. This is on them, Mr. Chair, members. It's not on the families or the providers. The agency has to step up. The fifth one, DHS said that licensure will protect the children. I don't understand how. Why is DHS having a meltdown when sadly abuse happens in a Somali-owned autism center? Who did the right thing and reported it? We as autism families have reported abuse in autism centers such as Minnesota Autism Center for years, and DHS never listened to the families. I see this as a differential treatment by DHS. Number 6, please hold DHS and yourselves, Mr. Chair and members, accountable for the lack of oversight and training for autism centers and autism families. I've given you multiple ideas if people wanted to listen. The 7th one is I want to inform you of the newest program, CFSS, that DHS has unleashed is anything but smooth. The day when DHS, Mr. Chair, releases any program that's smooth, I'm going to party like it's 1999. There's no oversight, no clear language for families. Nobody knows who's supposed to get one. The consultation agencies just kind of sit on their programs or on the child's program forever. The county is like, well, we don't know what to do. And then now we're giving access to somebody they're calling responsible party, who is
Idle,
not.
do you want to close up your sentence here so we can move on?
Yes, I will close up. The responsible party, Mr. Chair, is somebody who doesn't have access to the children's information. They shouldn't have access because the background study is not done. So are you going to make this person have background study done on them? Otherwise, why are we giving them access to sensitive information? And if I had 3 minutes, am I over the 3 minutes?
You're way over the 3 minutes. So.
All right. Okay, well, finally, just Mr. Chair and members, if you can make sure that you're keeping children with autism safe, you're keeping children with disabilities safe, making sure people have their background studies are done, there's oversight, and then also hold the MCOs accountable if the goal is to cut. Thank you so much.
Thank you, Idle. Good hearing from you. Next is going to be Anissa Haji Mohammed. You're on Zoom as well. Go ahead.
Hello, are you able to hear me?
Yes, indeed.
Okay. Chair Hoffman and members of the committee, my name is Anissa Haji Mohammed, and I'm the board chair of Mongod Voices, an organization advocating for the autism community. I'm also a mother of 3 autistic children, 2 of which receive waiver services. Beyond that, I'm an unpaid parent, peer parent advocate working with families, helping them navigate county, school, and medical systems so their children get the services they need. I'm here today to urge you to reconsider the proposed $1.2 billion in cuts to disability services proposed by the governor. For families like mine, waivers are not a luxury, they are a lifeline. They allow our children to receive in-home supports, therapy, and respite care, keeping them safe, engaged, and able to thrive. But instead of expanding access, these cuts will further limit essential services, increase barriers for families already struggling to access care, and push providers out of the system. It's interesting that in the proposed budget, there is $11 million that is going to be allocated to AI and machine learning to detect fraud in Medicaid and disability services. And families, this budget seeks to invest in technology that will police and scrutinize the very people who are already drowning in bureaucracy and systemic barriers. Let's be clear, this administration wants to modernize fraud detection using AI, but it also wants to divest from the very people these programs are meant to serve. It is disturbing that we have money to invest in artificial intelligence, but not in the direct human services that children and families need to thrive. If we were talking about fraud, let's talk about the fraudulent assumption that there is a surplus of resources available for disabled children and their families. There's no excess in services. In reality, families are fighting for every single hour of support that they can get. Waiver programs are already underserving families, and we know because we fight every single day to help families get fair budgets to meet their children's needs. And cutting these waivers would cutting them in an attempt to reduce fraud, it doesn't make sense, and it would result in resource deprivation for families. Finally, parents like me who are unpaid caregivers and advocates do the work that the state should be funding but isn't. And so my many hours of unpaid labor is so that other families are able to get the services that their children need. And so with this proposed budget, this makes our work harder and will increase the difficulty that parents go through. And children will continue to be underserved, and that will only result in billions of dollars in the future, and that's not something that any of us want. And I just want to say that for Governor Walz, I want to acknowledge something personal. As the father of a child with a nonverbal learning disorder, you understand what it means to fight for individualized support. You've spoken publicly about your son's journey and how families like ours rely on a strong support system. This budget is not just about families like mine, it's about yours too. It's about ensuring that all families raising children with disabilities have access to the services they need. Our call to action is that we restore full funding to waiver programs and that they are not cut. Also that we ensure oversight for reforms that do not push out diverse providers and unnecessarily impact diverse communities. And the last is to stop passing policies in a way that drowns families in technicalities while making it nearly impossible for them to advocate for themselves. Thank you very much for giving me the opportunity to speak.
Thank you, Ms. Mohammed. I appreciate that. Wade Stuvey, we had Nathaniel Olson, but he is in another hearing, so I'm going to bring him up. So if you could get Carrie Edelman, Ethan Vogel, Buck, and Phil, if you guys want to work your way up to the table, that'd be great. So Wade, welcome to the committee, and thank you for reaching out this morning and coming in.
Okay, Chair Hoffman, thank you for allowing me to be here today and talk about how the developmental disability waiver has changed our family's life. I'm the parent that provided pictures of my son. I wanted you to see who is receiving these services that you are providing. My name is Wade Stuvey. My son's name is Trent Stuvey. He is 15 years old. We live in Fergus Falls. Trent is receiving consumer-directed community support through CDCS. Trent receives personal support and respite care services. Here is why Trent qualified for the DD waiver. During Trent's delivery, he suffered a skull fracture and a brain bleed. A few hours after Trent's birth, he started having seizures. We were told he probably would not live. Trent was airlifted to Minnesota's Children's Hospital for emergency surgery. The surgery saved Trent's life. Trent spent 5 weeks in ICU recovering, but the injury left Trent with lots of disabilities. Trent has epilepsy. He's been on 14 different seizure meds, 4 at a time, all maxed out. None of them have stopped the seizures. He has a history of going into status where the seizures don't stop. He then gets incubated, flown to Rochester or St. Paul Epilepsy Hospital. Trent has autism. Trent is nonverbal. Trent is still in diapers. Trent doesn't feed or dress himself. Trent doesn't have the social skills right now to have any friends. Trent requires 24/7 care. My wife and I even take turns at night sleeping in his room, so if he goes into a seizure, we can quickly give him his rescue med and prevent him from going to status. I usually get volunteered for that because I'm a light sleeper. The benefits of the DD waiver. We were able to hire a para last summer from Fergus Falls School District to do respite care for our son. Not only did she give 2 exhausted adults a break, allowed me to get a haircut, mow the lawn, take my 90-year-old father out fishing, but most importantly, she became my son's best friend. She would take Trent to the park. She would take him for walks. She would read to him. She would teach him new games. She would go on the carpet and play with him with his toys. She even tried to help us potty train Trent. And she did so much more. She even asked us, what can I do to help him get ready for the 8th grade? Trent would get up in the mornings. He would go next to our door, look out the window, and wait for Gail, our para, to show up. He would be so excited. I've never seen Trent so happy in his life as when she pulled into the driveway. He had a new best friend. He looked so forward to seeing her every day, it would bring tears to your eyes. Gail loved Trent, the para we hired, and wants to come back and work with him again this summer. Our son can't wait to see her again. Trent also takes occupational therapy where they're working on dressing him, combing his hair, brushing his teeth. He takes speech therapy where they're trying to teach him to use an iPad to communicate with us and other people. Most people don't realize how stressful it is raising a special needs child, especially one that needs 24/7 care. But this program has been so life-changing for our family, I can't even tell you how much we appreciate it. Please don't cut the DD waiver program. So many families depend on it, and it is life-changing for our family. Thank you for your time and your attention in this important issue. Thank you.
Wade, thank you so much for sharing that. Carrie Edelman from SEIU Healthcare Minnesota and Iowa, and then Ethan Vogel from AFSCME Council 5, Buck McAlphin, the Ambulance Association, and Phil Stahlberger from Carver County. You guys are up next. So who's going? Carrie?
Yes, thank you, Chair Hoffman and members of the committee. My name is Carrie Adelman. My family lives in Lakeville, and I'm a home care worker. I'm testifying on behalf of my union, SEIU Healthcare Minnesota and Iowa. We represent over 55,000 workers in hospitals, clinics, nursing homes, and self-directed home care. I want to highlight two important elements in the governor's budget. Both make very targeted investments in the workers who provide care to the elderly and the disabled. First, the governor's budget provides about $15 million in the out years to fund the minimum wage rule from the Nursing Home Workforce Standards Board. The rule provides an industry-wide minimum wage of $19 an hour in 2026 and $20.50 the year after. There are higher minimum wages for certified nursing assistants, trained medication aides, and licensed practical nurses. The rule is contingent on you funding the increased cost to the nursing home reimbursement system. You can have absolute confidence that the money will go directly to workers and help ensure quality care for our seniors. Second, the governor's budget invests $68 million this biennium to fund the tentative contract agreement for over 30,000 SEIU home care workers in 4 home care programs. The programs include PCA Choice, CFSS Budget Model, CDCS program, and the Consumer Support Grant. The settlement includes a 40 cent per hour raise for some workers in 2 programs, PCA Choice and CFSS Budget Model. It provides $1,200 stipends with one-time money, and it lays the foundation of a defined contribution retirement program. This contract is very personal to me. Almost a decade ago, my son Keegan, an Iraqi war veteran, was in a motor vehicle accident. He sustained life-threatening injuries, including broken bones, internal injuries, and a severe traumatic brain injury. Today, he is unable to speak, feed himself, walk, or perform any activities of daily living. We were told to find him a nursing home. Instead, we brought him home to live with us. We couldn't find staff because the wages were very low. So I gave up a 6-figure career to become his caregiver, and I have no regrets, but becoming a caregiver has been a financial setback for our family. This contract gives me some hope for a retirement plan. It doesn't immediately put any money into a retirement plan, but it sets up the infrastructure for something like an employer 401k. The home care contract is also contingent upon funding from the legislature. These programs have no automatic inflationary increase for us to bargain over. In a tight budget environment, both proposals directly fund wage and benefit increases for the critical frontline workers like me who provide essential services for seniors and the disabled. Funding for these programs has always received strong bipartisan support, and we hope to work with you and all members to continue that tradition. Thank you.
Thank you, Ms. Edelman. Next, Ethan Vogel, AFSCME.
Thank you, Mr. Chair. Good afternoon, committee members. For the record, my name is Ethan Vogel, Legislative Director with AFSCME Council 5. I appreciate the opportunity to speak to you today. AFSCME Council 5 is a public and private sector labor union. We represent more than 43,000 workers across the state, including many employees at DHS and within direct care and treatment. We advocate for excellence in services for the public, dignity in the workplace, and opportunity and prosperity for all workers. I'm here today to support the funding increases for frontline staff in direct care and treatment and the operating adjustments to invest in the critical work our members do. Continuing to invest in the frontline workforce of direct care and treatment is a matter of staff safety. Of course, no amount of funding can make these jobs completely safe. Our members get asked all the time, well, didn't you know that taking this job was going to be dangerous? And of course they did. Obviously, working with mentally ill and dangerous folks, working with a population a court has deemed to be sexually dangerous or sexually psychopathic, just as a few examples, has inherent risk. Our members know that, but they also know that funding decisions made here have an impact on our ability to negotiate competitive wages, and that competitive wages are critical to recruiting and retaining staff, to achieve safe staffing levels and limit the use of overtime so that when overtime is necessary, it's filled by someone opting to cover the shift and not filled by forcing someone to stay after their normal shift. While progress has been made over the years, and most notably in the last couple of years, there is still significant work to be done to ensure that Minnesota is an employer of choice. And it's really hard to understate how fragile this system can be, specifically when it comes to the rapid effects relying on forced overtime can have on the workforce overall. It's important that we don't take our eyes off the road on this. Once that level is reached, it's a vicious, perpetual cycle of turnover and retention challenges that take a long time to build back out of. And in closing, Mr. Chair, while we appreciate the difficult and looming budgetary challenges that we face, especially considering the significant uncertainty the new administration is causing at the federal level, we do have concerns with the size and the scope of the proposed budgetary shift onto counties, among other cost-saving measures in this proposed budget. And I tend to agree with the recent comments of Senator McQuaid in the committee the other night that we shouldn't be making these tough decisions just in the vacuum of human services expenditures. We ought to be weighing these decisions against the preferential tax treatment enjoyed by profitable corporations as outlined in the tax expenditure report. Thank you for those comments, and thank you for your time.
Thank you, Mr. Vogel from the AFSCME members. Buck McAlphin from the Minnesota Ambulance Association, Phil Stahlberger, Lori Schlutenhofer, you want to work your way down, and Brian Zervis, you want to work your way down too? I thought, Brian, where are you? There you are. Buck.
Mr. Chair, members, Buck McAlpin about the Ambulance Association. I'm also representing a group of rural non-emergency providers called R80. It's 8 different companies that probably have about 600 vehicles in rural Minnesota that do transports. And on the Ambulance Association side, North Memorial, Alina, M Health, Fairview, and Health Partners are big hospital-based transportation providers. Boy, since I got involved with NEMT back in 2004, it's always been a big issue to the ambulance industry because, as many of you have heard in the health committees and Senator Wickland's committee, the ambulance industry is highly impacted when we don't have sustainable rural, especially non-emergency transportation. And as we've noticed that decline over the years, the availability of that puts strain on our ambulances, and we're taking our 911 trucks to do a lot of non-emergency work, sometimes 30, 40, 50, 60 miles outside of a service area. So back in 2014 with Senator Sharon, there was a work group, Mr. Stahlberger remembers it, that went on for years to really look at non-emergency transportation, and we all agreed and put into statute back then for the Department of Human Services and the Department of Transportation to put out an RFP to develop a single administrative platform. Exactly what the governor's budget here proposes. We believe the governor actually has good intent, and probably DHS and what they're doing here, but just a couple things that we want to be, well, and I'll step back. The goal of that was to address fraud, eligibility. We really have software now that does tracking of the vehicle from point of pickup to drop off. We can validate that ride took place with software that's out there. Develop a single framework for reconciling trips, and most importantly, providers paid timely for cash flow. That's still a problem today in that industry. which is 90% plus Medicaid, is really who uses non-emergency medical transportation. And even the clients that I work with, I asked them the other day, they're turning down about 4,500 rides a month because half their vehicles are parked because of the low payment. Over the years, the health plan model, the health plans have managed them. Health plans do pay more and negotiate better with these companies for non-emergency transportation. And fee-for-service has always been a little bit on the lower side. And the one thing we notice as an industry is the fee-for-service population is usually the more disabled group that really needs access to paralift vehicles. So as we look at the fiscal note, Mr. Chair and members, and I have talked to Mr. Stahlberger about this, we want to be sure when we work at a model like this, the legislation from 14 required a couple pilots, whether we do some pilots for a year or do something to try to evaluate this. There is a software available now, and we've seen it that actually does what we want to do with this project and do it right. And most importantly, that we're able to do something with rates for providers.
Thank you, Mr. McAuliffe. Right on time. Mr. Stahlberger.
Thank you, Mr. Chairman, members. My name is Phil Stahlberger, Senior Vice President, Public Affairs at MTM. Medical Transportation Management is what it stands for. This is actually what we do. We support the governor's budget, as Buck talked about. We are currently working with 17 of the 87 counties in Minnesota in the fee-for-service world. We believe moving to one single statewide structure is the right thing to do. In all of the states that we work in, and we work in over 45 states across the country, we're performing 25 million trips a year, working with over 2,000 transportation providers across the country. Non-emergency transportation providers are the backbone of this program to make sure we are serving the most vulnerable. So we do support the governor's budget, and as Buck talked about, we've been talking about this issue since 2004 in the state of Minnesota. The state of Wisconsin, the state of Iowa, both do exactly what the governor's budget is doing. We operate in both states. There are competitors that we work with in various states. But at the end of the day, DHS and or you would know exactly how many rides are happening each and every day and how many rides aren't happening each and every day. In our discussion with counties across the state, and we are in the works of talking over 20 different counties who want to work with us because they're done trying to figure out this benefit. They're frustrated. They don't have the wherewithal to go into Otter Tail County or different parts of Minnesota where there aren't a lot of transportation providers. So we need all forms of transportation to perform these trips. And we believe this is probably the most efficient way to do it. And as Buck said, it is about fraud, waste, and abuse, but it is about coordination of rides. In our discussion with some of these counties, we're finding that there are probably rides that aren't happening today that we don't know about because there are no drivers available. We can't rely on the ambulance industry. We can use TNCs, Uber and Lyft, others in other parts of the country. We need to essentially have trains, planes, and automobiles for non-emergency transportation. And we believe this is a step in the right direction. Thank you, Mr. Chairman, members.
Thank you, Mr. Stolberger. Thank you so much for doing that. And now Lori Schlutenhofer, Member Board Directors MOHAR, and then Brian Zervis.
Yeah, thank you, Mr. Chair and members of the committee. My name is Lori Schlutenhofer. I am co-president and CEO of Services for Opportunity Partners, a provider of disability services. I'm also here, as the chair mentioned, representing and speaking on behalf of MARRCH, the Organization for Habilitation and Rehabilitation, which is a statewide trade association of over 100 providers providing services to people with disabilities in Minnesota. It was, to be really blunt, it was really disappointing for us to see the proposed state funding reductions for waivered services that were presented in the governor's proposed budget. Two provisions specifically that will have a significant negative impact on access to disability services. The first of which, found on the bottom of page 133 of the Human Services section, would reduce the absence and utilization factor for day services provided to people with disabilities. To put it as simply as possible, the absence and utilization factor is meant to balance the resources, staff and facilities that we are required to have in place. And despite the fact that we only get paid when people are able to attend. A lot of our members provide services to people with significant impacts to their health and their ability to attend services on a regular basis. The utilization factor is meant to account for that and help us have services available when needed.
Check 1, 2, check 1, 2.
Okay. Excuse me. The proposal would do is roll back that absence and utilization factor from 9.4% to 3.9%. I can just give you a quick example that for my organization, the people we support have an absence rate of about 11%. So there's a wide gap there. The other issue that I want to call attention to is found on page 136. And that is the proposal to cap the already legislated scheduled inflationary adjustments for waivered services to a 2% increase every 2 years. And what that means is, as we're looking at, we have the data already that would be used for the next adjustment in 2026, which is meant to help cover the price increases we've been shouldering in providing services for about 2 years. And that gap, that increase would average around 14%. And what this is asking us to do is cap that at merely 2%. I could give you examples of what that financial impact would be for my organization and others, but I think what is most important and most striking for us to consider is because of the way that Minnesota's Medicaid and waiver funding is structured, every dollar of Minnesota funds that are budgeted are matched with a dollar from federal Medicaid funds. So what we're looking at, these cuts we're looking at for the people, the community that we serve, they'll be experiencing double that because we'll be losing that federal match as well.
Thank you, Lori.
Really,
Lori, your time is up, so
Okay.
if you can, you're going into another phrase. I got an hour and a half worth
Here's
of
my
stuff,
phrase.
so why don't you end it?
We know
That'd be
we've got
great.
a hard job
Thank you.
ahead of us, you and all of us in the state, and we remain committed to coming back to the table, looking for ways to be more efficient with the staff that we have and find a solution that doesn't damage the lives and supports of people with disabilities. Thank you.
Thank you, Ms. Schlutenhofer. I appreciate that. We're going to need you in this. Brian Zerbies, and before you start, Ezra McNair, Leah Cameron, and Josh Berg, you want to work your way up to the table, that'd be great. Brian?
Thank you, Mr. Chair. My name is Brian Zerbis. I'm the Executive Director of MARRCH. MARRCH is a statewide association of substance use disorder programs and professionals. Thank you for the opportunity to provide feedback on the governor's budget. I think one positive that we see in there is the extension of audio-only telehealth, so we appreciate that. Big glaring concern is a miss in the governor's proposal related to the outpatient rate study, specifically substance use disorder rates were not included in the proposal. Providers have undergone over a decade of multiple studies looking at rates. We finally had an analysis done that was introduced to this body last January that looked at cost-based rates for substance use disorder programs, mental health programs. Within that study, I identified 8 of the 9 rates for substance use disorder needed an increase, an average increase of 68%. On Monday in this hearing, it was discussed other parts of the industry that had increases, nursing home for 100% since 2007, long-term care in 2023 at a 45% increase. Mr. Chair, what you had mentioned on Monday was those rates were long overdue. And what I'd like to express to this committee is the outpatient rate study for mental health and SUD, those rates are also long overdue. So we hope that this body can look towards the projected $355 million left on as a part of the governor's budget in state fiscal year 20 and 29. We know that programs are burned out, staff are burned out. In the last 3 years, there's been a net reduction now of 47 substance disorder programs throughout the state. Over 40% of those are closures in greater Minnesota, which we all know has a larger impact. And 8 of those programs that closed were adolescent focused. We don't see any of this getting better or changing until some of the fundamental rates can be addressed. We ask that you have a balanced approach towards regulations and rates in this upcoming session. We know that treatment works. We know that it's a good return on investment, both in saving dollars in public safety, child protection system, averted healthcare costs, et cetera. We did provide a letter, so there's more details in there. I want to thank you for your time and look for your support this session.
Thank you, Brian. Thank you. Again, we're going to need all your words as well. Ezra McNair, Leah Cameron, and Josh Berg. Josh can, hey, there you go. Ezra, welcome to the committee. Say your name, please.
Hi, my name is Ezra McNair, Honorable Chairperson Hoffman and members of the Human Services Committee. Thank you for the time to speak with you today. I'm non-binary. I'm the advocacy organizer and volunteer manager at the Aliveness Project. I've been a Minnesota resident my entire life and was a 2022 Augsburg University graduate. And I've worked with the Aliveness Project, Minnesota's Wellness Center and Clinic, serving the HIV community for 3 years. I've come to speak to you today about the governor's proposal to maintain funding to end HIV in Minnesota. That's page 27 on the budget. This year, the HIV community in Minnesota is anxious. 2024 saw multiple HIV/AIDS service organizations close, leaving many people who live with HIV to turn to the Aliveness Project as their primary source of care. At Aliveness, we responded to the steady influx of new members the only way we know how, with unwavering resilience and a commitment to providing accessible care and accessible and life-affirming health care. Our community knows that HIV cases continue to rise in Minnesota. A few of the most populous counties in the state are still experiencing HIV outbreaks that were declared in 2022. The governor's proposed allocation of $6 million in funding will ensure that providers and communities aren't asked to do more work with less resources. As a manager of volunteers, I've been blessed to see a unique side of the HIV community. Volunteers at Aliveness serve our daily meal, help in our food shelf, and pack harm reduction kits. It's my job to train and orient new volunteers into these programs. I've seen folks who are newly diagnosed come to Aliveness and witness how lives are changed by our wraparound services and increased access to medical care. They feel that impact in themselves. They can feel firsthand how empowering achieving an undetectable status can be, and they want to replicate that feeling in others. They see how a smiling face, caring words, and a hot meal can build a trusting relationship that leads to medical adherence. The 100 Aliveness members who donate their time to give back to their community have redefined what service means to me. They're doing what they can to struggle against HIV by equipping themselves with skills and knowledge that they can pass on to the next newly positive person. The lesson that we can all learn from them is how they lead by example. Not only have they steeled themselves against a dire health outcome, but they've gone the extra mile to provide care for others. It's a beautiful example of the solidarity Aliveness fosters. Our members who volunteer haven't lost hope, and they won't despair. Aliveness and our volunteers continue to work to end HIV in Minnesota and provide care to their neighbors no matter what happens. Any cuts to our funding make our work that much harder and only create more HIV cases, leading to costly stress on the state's healthcare system. I ask this committee to follow the selfless example of our Aliveness volunteers and be leaders in the fight to end HIV. Support the governor's measure, support this funding to ensure that we can keep doing this work. Thank you.
Thank you, Ezra. Next is Leah Cameron, Director of Support Services, Customized Living and ICS, Clare Housing. Hey, Leah, welcome back. And then Johnny Vet, are you around? Where's Johnny Vet? There he is. You want to come on and grab a microphone? So go ahead, Leah.
Good afternoon, Senator Hoffman and members of the committee. I'm Leah Cameron, as you know, representing Clare Housing, a nonprofit serving Minnesotans with HIV for over 35 years. We provide affordable housing and supportive services to those who would otherwise face homelessness, hospitalization, or institutional care. Let me introduce you to Joe. This is Joe. He is a veteran and longtime Clare Housing resident. Joe came to us after a hospital stay, first living in our foster care home, before transitioning to independent living at Clare Apartments in 2008. Thanks to our 24-hour customized living program, Joe has stability, independence, and the support needed to manage his health. This program works. It allows individuals like Joe to live with dignity in a private home while receiving essential care. Unfortunately, the governor's budget proposes ending 24-hour customized living as we know it. While current residents may stay, the program would shrink over time, ultimately leaving many without essential support. Without these services, individuals will be forced into nursing homes or back into homelessness, both costlier to the state and devastating to their independence. Reducing the age of individuals for customized living will greatly impact those we serve. Currently, 70% of participants in our 24-hour customized living program began receiving services prior to age 55, highlighting the significant need for age-inclusive supportive housing solutions. Many individuals living with HIV and related health complications require assistance well before age 55, and restricting access would put their health, stability, and independence at risk. Additionally, on another subject, but touched on by Ezra, we urge the legislature to support HIV funding. The proposed $6 million is a step forward, but falls short. At least $9 million is needed to fill major service gaps. Organizations such as Open Arms have already cut services, and Clare Housing is facing client unenrollment. Cuts in Ryan White funding could impact 150 individuals who rely on us for stable housing and critical health care. We urge you to protect 24-hour customized living and secure ongoing HIV funding. The people we serve deserve stability and dignity, not uncertainty and displacement. Thank you for your time.
Thank you, Leah. Mr. Josh Berg.
Thank you, Mr. Chair and members. My name is Josh Berg. Today I'm here to express my shared disappointment in the governor's proposed budget, a budget that allocates 65% of the proposed cuts to a base budget that makes up roughly only 25% of the overall budget. I'm as confused as you on why anyone feels this is the Minnesota way. I am no Mr. Raymond, but even for me, that math isn't mathing. And while I understand the need for cost-saving measures due to the forecasted deficit, I firmly believe that many of the governor's proposals and the details within them are short-sighted, ill-advised, irresponsible, misrepresented, or inaccurate, and will ultimately be ineffective in reducing overall costs. Thankfully, if anyone reads through the hundreds of pages in the proposal, you'll actually find all the reasons you need not to include many of these in the final legislation, coming straight from the governor's office and administration. So let's focus on and highlight some of the possible solutions and ideas that can address the projected financial pressures in the years ahead. I want to thank you in advance for the work you will do over the next few months to come up with better, and yes, Senator Etke, we can and must do better, more effective and more innovative ways, Senator Abler, to bend the cost curve. Together we can do something, and we must do so with urgency and purpose. In fact, you will see me and many others in this room bring forward ideas this session that actually reduce the total cost of care across the system, while also innovating and improving access, quality, and outcomes from those supports and services. These will include things like expanding the Juniper Community Care Hub and leveraging the work we are doing at Trellis and Juniper to help Minnesotans thrive while they live independently with less costly and more effective supports. We can build on the tremendous work of the Acute Care Transitions Advisory Council and the Complex Transitions team at DHS. We have identified ways for DHS and lead agencies to be more efficient and streamlined, resulting in greater access to critical services along the continuum, help lower administrative costs, and improve the system for all living and working within it. And we can invest in lower cost, more effective, and more person-centered services and programs that already exist and just need some refinement, like integrated community supports. And these real and innovative ideas, Mr. Chair and members, is where we can actually decrease costs, maintain appropriate access, ensure accountable and quality services to the individuals living in our communities, and get the best use of dollars and investments in the human services areas within this committee's jurisdiction. I will end by repeating what you, Mr. Chair, and others have said throughout different times of this session in this committee. Our collective test of this committee and this government is how we treat those in the dawn of life, the twilight of life, and those in the shadows of life. This is our collective why, and we can do better.
Thank you, Mr. Berg. Jonathan, and then Nathaniel, you welcome. Nathaniel Olson, you join, come on up to the board, and what we're saying is 3 minutes. We're allowing people 3 minutes. You can do that within 3 minutes. And then From there, let's go Johnny, and then Nathaniel, and then Dawn Simonson and David Swanson. If you want to work your way down, you're the next contestants on the prices. Well, that's not funny. I'm sorry. Johnny.
Good afternoon, Chair Hoffman and members of the committee. My name is Johnny Tevets, and I'm a policy manager for ARRM, a trade association representing disability waiver service providers across Minnesota. Thank you for the opportunity to provide testimony to the governor's budget recommendations. I'm here on behalf of our members to express our deep concerns and disappointment regarding the proposed cuts to disability waiver services and the impacts these proposals will have on people with disabilities and their staff. First, ARRM strongly opposes the proposal to cap inflationary adjustments at 2%. This proposal will exacerbate an already dire workforce crisis. Direct support professionals, which are a majority women and people of color, are already underpaid, making an average wage of a little over $17 per hour. This adjustment will further erode their wages. We hear time and time again that I love this job, but I can't afford to keep doing it. These caps threaten not just jobs, but the essential life-saving care they provide to Minnesotans with disabilities. Additionally, ARRM has strong concerns with other proposed reductions to disability waivers outlined in the budget proposal, including limiting rate exceptions, a tool that providers utilize when supporting individuals with exceptional needs, capping billable days to 351 in a calendar year, and limiting individual home supports with training to 8 hours a day. These proposals, along with others included in the budget, will cut $1.3 billion over 4 years from disability waiver services, destabilizing and dismantling an already fragile system. The administration suggests that these cuts will not reduce access to services. It'll only cut costs. This assertion is unrealistic. You cannot remove that much money over 4 years from an already strained system without serious consequences. Low pay and rising costs will lead to greater turnover, uncompetitive job openings, diminished quality of care, and increased barriers for families already struggling to support their loved ones. The governor has spoken about protecting progress in Minnesota, yet this budget dismantles the very foundation of that progress. Minnesota is proud to be a leader in compassion and fairness. We strive to be the best place to raise a kid, as the governor often says. But will we be the best place to raise a child with a disability? Maintaining the full inflationary adjustment and protecting disability services from the bevy of other cuts is not an indication of a program on autopilot, but rather the bare minimum to ensure this workforce and the people they serve are not left behind. I urge you to prioritize this community and protect the services that allow Minnesotans with disabilities to live meaningful lives. Thank you.
Thank you. And as we go to Nathaniel Olson, I just wanted to, Dawn Simonson and David Swanson, you want to start working your way down? There you two are.
Thank you, representatives and chairmen. I would like to thank you for allowing me to speak on the important topic of disabilities across the state of Minnesota, including myself. The Department of Human Services is required to pay attention and appropriate funding to ensure disabilities. That includes guardianship. I'm going to share a couple stories about myself. In May 2024, I was planning a trip to LA, and my guardian, who worked for the Department of Human Services, had the police stop me at a bus station. The point that she said, it was suicidal thoughts. There was no idolations. Second of all, after my discharge for 72 hours, I was supposed to see a psychiatrist. Knowing that I already had a psychiatrist, I was supposed to go see another psychiatrist across the state. When I called there, they didn't know who I was. My questions, what would have happened to me? These are issues that have been transformed across the system, and I'm thankful that I'm testifying today. I would like Minnesota to be the stepping stone of unnecessary hardships of abuse without guardianship oversight. The vulnerable adults that may have crucial control and protected their rights, and since the role of respect involves making important decisions of health care and finance and daily living agreements, ensuring that individuals' rights with dignity are preserved. Disability people are still struggling paying their rent and choosing the groceries. We need to increase the cost of living in the state of Minnesota, and that this is not a problem anymore. Thank you for listening to this speech, and I will be happy to take any questions. Thank you.
Thank you, Mr. Olson. Next, we have Dawn Simonson from the Minnesota Association of Area Agencies on Aging board member, president and CEO of Trellis, and David Swanson, Minnesota River Area Aging on. It's nice to see you guys in person, actually, so welcome.
Thank you. Good afternoon, Chair Hoffman and members. My name is Dawn Simonson. I'm a board member of the Minnesota Association of Area Agencies on Aging, M4A for short. We have one overarching aim, and that's to help older adults in greatest need live healthy and secure lives in the community. AAA's, Area Agencies on Aging, administer public funds and connect people to services. We are the conveners of the Senior Meals and Services Coalition. M4A is deeply concerned by our collective failure as a state to develop and act on a comprehensive strategy that supports older adults trying their very best to live at home for as long as possible. These older adults do not drive, they live alone, physical conditions prevent them from preparing nutritious food or managing everyday household tasks. They may have cognitive impairment. Data scientists from the University of Minnesota confirmed again in a November 23 report to DHS that the older population is growing, we know that in total, and that the fastest growing segments are the older age groups that are most likely to need service and support. We have a serious situation, and it's been building for some time. American Rescue Plan Act funds and one-time state funds provided a reprieve, but ARPA funds for meals and supportive services are completely spent, and new state funds for meals were one-time. Our providers are cutting home-delivered meals, closing nutrition sites, and have reduced capacity to provide rides and homemaker services. We know the consequences. Malnourished seniors become frequent flyers in emergency rooms. When they forego medical care or live in an unsafe or unsanitary home because they cannot manage the cleaning, that too leads to decline. Older adults suffer and families give up. The only option is expensive assisted living or nursing facility care, assuming it's available. According to Genworth, annual nursing home care in Minnesota costs about $171,000 a year for a private room, and a portion of that cost quickly becomes one that the state bears. According to the DHS study I noted above, the majority of people entering an assisted living facility or nursing facility who are not on Medicaid when they enter become enrolled within 1 month. We've known for decades that meals and rides help people remain at home where they most want to be, and these services slow the need for more expensive care. This is a win for everyone. Investing in upstream services must be part of Minnesota's strategy to care for older adults. We ask that you hear our bill, authored by Senator May Quaid, to maintain the one-time $11 million appropriation for senior meals and add $4 million for assisted transportation and homemaker chore services. Senator Hoffman and members of the committee, it's imperative that you elevate the needs of community-dwelling seniors. They deserve our care and compassion, and preventing or slowing their spend down to Medicaid is a sound investment for the state. Thank you.
2 minutes, 53 seconds. Thank you so much. In everything you needed there. Thank you. Nathaniel, if you want to make room for, we need to get then Tom Gillespie from Living Well Disability Services, and Mary Krinke. If you're done talking to Tom Lehman, you can work your way down to the post. But I'm glad you're smiling at that. David Swanson, welcome back. Tell us who you are.
Hey, good afternoon. I'm actually Jason Swanson, and I am the Executive Director of the Minnesota River Area Agency on Aging.
It says David here, Jason.
I know.
That was, where's your Cub hat?
I know, right? I have Cub socks on, so we're set, Senator.
Okay, we're good.
Don't worry. Mr. Chair, good to see you. Good to see you all again today. I am Jason Swanson, Executive Director of the Minnesota River Area Agency on Aging. I'm also a co-chair of the Senior Meals and Services Coalition. I thank you for allowing myself and for my colleague Dawn to speak with you today. We are concerned that the potential budget decisions may increase the already unmet need for senior nutrition programs. This committee has been instrumental in raising awareness and supporting older adults in the state of Minnesota. This is evident by the investment that this committee made in 2023 through the Senior Nutrition Program. That funding was the first increase in the Senior Meals Program in decades. It was time limited and stretched over 4 calendar years instead of the biennial period. We urge this committee to continue this appropriation into the next biennium and senior services that will assist older adults to remain in their communities. The continued $11 million investment in the senior meals program will assist addressing older adults who are at risk of becoming food insecure with a regular, nutritious meal. A recent study by the Chesley Center on Aging of the Minnesota State University Mankato highlights the essential service of senior nutrition. The goal of the AAAs and our partners is to prevent older adults from becoming food insecure. The focus of our efforts is not all older adults. No, the focus of our efforts are older adults who are at or below the poverty line, have a chronic disease, a disability, lives alone, or lacks the ability to go to a store or a food shelf. When an older adult becomes food insecure, their nutrition becomes a problem. The older adult misses out on essential proteins, vitamins, and other nutrients. This leads to negative health outcomes that include asthma, congestive heart disease, diabetes, malnutrition, and depression. Over half the counties of Minnesota currently see greater than 20% of their populations over the age of 65. Rural older adults lack access to nutritious foods, the availability of a food shelf, a grocery store, or site that provides home-delivered meals. This leads to older adults becoming food insecure and allowing their health to decline. These negative health outcomes are later addressed, unfortunately, and often too late, through an emergency room visit, hospitalization, a skilled nursing facility stay, and may even be fatal. Our funding requests for senior support services will help address the lack of assisted transportation and also include a $2 million biennial appropriation to address transportation needs and $2 million biannual appropriation to provide services that include chore and homemaker services. Meals, rides, and others help at home are key to the support of our older adults. Your continued investment in older adults empowers them to stay active in their communities. Chair Hoffman, I appreciate your time and your support for older adults within the state of Minnesota.
Well said, Jason Swanson. Cubs win. Tom Gillespie and Mary Krinke, you're next.
All right. Chair Hoffman and members, my name is Tom Gillespie. I'm the president and CEO of Living Well Disability Services. Living Well started just over 50 years ago as Dakota's Children's. And to this day, we continue to serve many of the children who moved in to our organization all those 50 years ago. We exist to create long-lasting relationships and partner in the care and support for the folks that we serve. Roughly about 300 people across our metro area and about 36 group homes across our area. I'm testifying today to express my deep concerns with the governor's budget proposals related to the disability waiver rate system, DWRS. While each proposal is different, each one will make it more difficult for providers like Living Well to care for the people that we serve. The proposals to drastically limit inflationary adjustments within DWRS, to limit billing days for residential services from a full year of 365 days to an artificial made-up number of 351 that lacks logic, to other areas where we're restricting access to customized living services for people 55 and younger, and other proposals related to rate exceptions and input monitoring, all reflect significant steps backwards in the work that this group has put together over the last few years. You've done incredible work, you've made incredible gains for our area, and all of that is ripe for the picking right now. Living Well is known as an organization that has the ability to serve people with significant need for medical care. We are able to say yes to people when no one else can. Many of the folks that we serve require the close support of our staff literally every moment, every breath in a day. Their heads do not leave the pillow in the morning, and their heads do not return to that pillow in the evening without intervention and support from our staff. Please make no mistake, within the provision going from 365 funded days a year to 351, the folks that we serve do not take a 14-day vacation. They do not miraculously not need care for 14 days. This is the state heartlessly and logically gutting services to balance your spreadsheets. That's not the state I live in. I hope it's not the state that we live in right now. I sit here today to both ask for your support in fighting these cuts. But as my colleague Josh mentioned a moment ago, I'm also here to beg for a space at the solutions table. There are better ways to do this. We can achieve reductions in fraud and in whatever the frivolous extra spending that some folks are seeing. We're not, but we want to be at that table. We do have ideas. We do have areas where we can benefit this state without gutting services. Please invite us to that table while you fight these cuts, and let us make a better plan with you. Please. Thank you for your time. Thank you for the incredible support that you've given our community in the last few years. And please do not let any of it be taken back. Thank you so much.
Mr. Gillespie, thank you. Thank you for the reminder. This team will be reaching out to everybody today that is doing it, that has offered that. So as we get Ms. Krinke up, then we're going to take a shift. When you're done, then we're going to pull in some of our county folks. So Stacy Hennon, Katie Molinar, Luella Coffer, all the way from Minneapolis, is coming here, Nicole Hansen, and then Julie Jepson, who actually flew in this afternoon from Anoka County. She had to take the Anoka County airport in. So, Mary Krinke, the table's all yours. I'm not going to give you 3 times 5, 15 minutes, but you can sure tell us. Nice to see you again.
Thank you, Mr. Chairman. And for the record, my name is Mary Krinke, and I'm with the Minnesota Hospital Association. I have 2 provisions of the governor's budget that I do want to speak to today. But before I get started, I just want to thank you, Mr. Chairman, for taking the time to do this. You can't help but be struck by the stories that we've heard, and there is a continuum of care, and when you squeeze something over here, it pops up over here, and we're all sort of connected in this. And so I know you all know the hospitals have been struggling with discharge challenges, but if we can't discharge to a group home, or if we can't discharge to assisted living, or if somebody doesn't have their home health care, it's all connected. And so I want you to know the comments that I picked out today are specifically maybe more hospital-oriented, but I want you to know I've heard these comments today, and there's a lot of concern here. So thank you for doing this hearing. I just want to start out to say that the Minnesota Hospital Association is opposed to one of the provisions in the governor's budget proposal regarding carving out the pharmacy outpatient drug program. The proposal would move that out of managed care and into fee-for-service. And when that happens, it triggers a loss to all critical access hospitals, to our safety net hospitals, of about $86 million. Now, we're somewhat in competition with DHS over whether or not should 340B providers get that savings, or should the state be able to get a rebate dollar? And I think it's important for the committee to understand that when the state gets the rebate dollar, there is no federal matching fund. But when that money goes into the 340B outpatient drug program, it leverages federal matching funds, and that money goes back into the community, and it actually supports what our services are in our communities across the state. So the department's plan really doesn't say what they're proposing to do with the money. It just says they want to get additional rebate dollars, but it is at the expense of 340B covered entities. So we are against that proposal, and I know you all have heard a lot about the 340B issue, but it remains a concern for the Minnesota hospitals and the other covered entities, I might add. The federally qualified health centers receive 340B. The Ryan White AIDS Foundation receives 340B. Hospitals are not the only 340B covered entities. The other item I want to mention is we do support the governor's proposal to keep audio-only telehealth in place for the next biennium. Audio-only telehealth is really important for patients that have behavioral health, substance abuse, and chronic care conditions. And we still have parts of our state that don't have very good broadband. So even though you think everybody has broadband, they don't. And so we still have elderly patients and people with mental health issues that can't do the internet great, and so that audio only is very important. And so the governor funds it for the next 2 years, and we are supportive of that. We believe it is important for access across the state. So thank you, Mr. Chairman.
Always good hearing from you, Mary Krinky.
Thank you.
Thank you. Members, let's get our county. We're going to, the next two blocks is our county folks, and then after that, we got some folks from our care providers. So Stacy Hennon, you're all the way. Stacy Hennon. I love this. Traverse County. Kathy Molinar, Luella, Nicole Hansen, Julie Jepson. So I think there's going to be some other microphones there too. So Stacy, the floor is yours.
Good afternoon, Chair and committee members. My name is Stacy Hennon. I am the Western Prairie Human Services Executive Director and Traverse County Social Services Director. I'm here today representing the Minnesota Association of County Social Services Administrators, or MACSA, and I serve as MACSA's legislative champion. As you know, Minnesota operates the state-supervised, county-administered human services system. What that generally means is that the state sets policy, funding parameters, and gives guidance on the services and programs that are then delivered to individuals and families by counties. In a state-supervised, county-administered system, the goal is not to have 87 different versions of what human services looks like, but one mostly uniform set of programs, so that as people move from one community to another, they don't receive vastly different services within the same state. Consistency in policy, equity in funding, and a shared understanding of what services look and feel like for people are essential when delivering human services. This context is important as I talk about the cost shifts in Governor Walz's budget proposal. The areas MACSA is here to talk about today, if passed, will result in increases in local property taxes. So for Traverse County in 2025, the proposed shifts would be $395,000, and it would have been a 39.65% increase to our social services levy for Traverse County. For Western Prairie, which is Pope and Grant counties, for our 2026 budget, that alone with nothing else, no wages, nothing else, would be a 17.73% levy increase. For Pope, that would be $381,129.81, and for Grant, $238,290. And since we split our waivers between social services and public health, that would be an additional $90,000 for Pope County and an additional $72,000 for Grant County. So that's the kind of cost that we're looking at shifting to counties that have populations between under 10,000 for two of them and under 15,000 for the other one. Counties that have the highest levels of poverty often have the lowest abilities to generate revenue through property taxes. Shifting costs related to our most vulnerable Minnesotans onto property taxes will create inequities in access to services, and that's the very thing we work to prevent. My testimony today will focus on the areas of behavioral health in the governor's budget. So the Behavioral Health Fund. Since direct access implementation, counties have considered proposals to eliminate this 22.95% that counties now pay, since counties no longer really have a role in the assessment, placement, or services that individuals receive. This is simply a cost share with no ability to influence services. So to see that the proposal in the governor's budget that would increase the county cost share to 50% for the Behavioral Health Fund is somewhat surprising. Consider the limited county role with no ability to influence services. Statewide, this shift will ultimately be an additional $9 million per biennium placed onto counties. The Minnesota Sex Offender Program, County Human Services has a limited role in the service delivery of individuals in the Minnesota Sex Offender Program, or MSOP. This program is for individuals who are committed and need additional treatment, often after serving a prison sentence. Only the court has the authority to commit or discharge someone from MSOP. These commitments most often are done by the Attorney General, with some handled by county attorneys. County human service involvement is primarily financial in that we pay for a portion of that cost of care dependent on the person's admission date. The governor's budget proposal would increase the county's cost share for MSOP sex offenders from 10% or 25% to 40%, for a total of $39.6 million per biennium. This results in a $19.8 million cost shift to counties. Locally, for Western Prairie, we would need to increase the budget line item by an additional $293,000 per year, and Traverse County's shift would be $308,000 per year. For competency restoration, the county's role, the county human services role.
I'm going to, sorry, Jordan, I just, but this is that number, I didn't mean to break our rule. We were going to say we were going to. What's the? Do you want to answer that? Ask that.
Thank you, Mr. Chair, and thank you, Ms. Hennon. And I was wondering if, you talked about for Traverse County, the two different costs there, and it sounded like, just on the two that you've gotten to so far, it's more than $300,000 on an individual basis. Is that correct?
The first cost, Senator, the first cost was the combined. 308 is part of that combined.
Got it. And what's the population of Traverse County?
3,500.
3,500. So you're looking at about Mr. Chair, that'd be, a $300,000 cost divided over that population. It's, think about the impact of that.
Thank you. I didn't mean to stop the process, but I just like Travis. It reminded me last year, Senator Utke and I had brought this committee, and this committee paid for it's Beltrami and Todd County. Senator Utke, am I correct on that? Yes. They were 300. They owed this Department of Human Services, and we're like, they didn't have the money because 70% of their land was. So that's very not comforting. That's good for us to hear that. So I won't interrupt anybody anymore. But if you could finish that and then go on to, I think Katie's next after that. So thank you.
The County Human Services role in competency restoration is limited at best. So. Since no civil commitment is required under Chapter 611, there would not likely be an open social services case, and therefore no county of financial responsibility would be determined. Counties are supportive of people getting the treatment services they need, especially when they meet hospital level of care and need to be served in a DCT proposal, but the governor's budget would apply existing county cost shares to the competency restoration program as well, for a total cost of $16.7 million per biennium. And the goal of this proposal was to offer clarifying language and also find a way to pay for competency attainment in certain circumstances. However, county human service agencies are not likely to be involved in these cases as the person is not civilly committed. We expect this to create more confusion rather than provide the clarity that's intended. So it's unfortunate that in the areas where counties have less and less ability to control costs, those are the areas that are currently being contemplated to shift more costs to the counties. A move further in the direction of shifting costs to counties and service areas where they are unable to control those costs seems like an unfair position. We recognize that budget decisions are difficult, and we're here to be partners in the work of having difficult conversations about service delivery needed reforms or cuts to service. We're grateful for some of the proposals outlined in the governor's budget, specifically transitioning the adult mental health grants to a direct payment model, assistance in providing access to a federal data source for our eligibility programs, and a concerted investment in fraud, waste, and abuse, in which counties have a strong desire to be a partner in this important work. We hope to join you again to talk about our association's priorities, which focus on cost-effective technology solutions, administrative simplification positions, and the necessity of long-term investments in our state hospital system to address the hundreds of people suffering today to receive intensive hospital-level care of service. We appreciate you having us today to start the conversation. And with that, I'm happy to answer questions and turn it over to my colleagues.
Thank you, Ms. Hennon. Let's go to Katie Molinar all the way from Ramsey County, Minnesota.
Thank you, Chair Hoffman and members of the committee. My name is Katie Molinar. I serve as a Deputy Director within the Social Services Department at Ramsey County. I lead the Aging and Disability Services and MinChoices Division. I'm also testifying on behalf of MACSA today. I will speak to the potential impacts of the governor's budget proposal related to disability waivers. As you've heard today, we serve individuals of any age with a disability. Our disability waiver programs are incredibly complex, from their funding to the complex needs of the residents receiving those waiver services. Typically, counties work with DHS, as my colleague described. Via a MinChoices assessor, counties assess an individual's needs, determine eligibility based on criteria set forward in state policy, and work with the individual to set up services to meet their assessed needs. There are 4 proposals within the governor's budget related to reducing the growth of disability waiver services. Within those proposals, there's a new 5% county share for disability waiver services, totaling $82 million in 2027, $97 million in 2028, and $107 million in 2029. In Ramsey County, this is a 5% cost shift, is projected to be $13 million annually, which is equivalent to a 4% tax levy increase. I'll say that again. $13 million annually, which is equivalent to a 4% tax levy increase. This is our best estimate right now based on the available information, and we do continue to review this. To be clear, this is a shift to counties and doesn't save money within the program. It's important to note here also that Ramsey County is unique. 1 in 3 residents is on safety net programs. We are also a county in which our residents' median income is less than the cost of living. The proposed cost shift to counties would have a devastating impact to our residents. We also have serious concerns regarding how this may impact access to services. If counties are not able to sufficiently levy to fund these programs, it may result in vulnerable individuals not receiving services they're assessed to need or creating a patchwork of access across Minnesota's 87 counties. This is not the system that we strive for. The system we strive for serves Minnesotans with dignity no matter their county of residence. We know this is the beginning of a conversation regarding how to address difficult state budget realities while continuing to serve our state's most vulnerable individuals. Please consider counties as your partners in tackling these challenges. For the last several sessions, we have proposed measures to simplify and streamline our human services systems in ways that preserve quality while reducing paperwork and lowering overall system costs. We look forward to continuing these conversations. Thank you for your time today, and I'm also happy to answer any questions.
Thank you, Ms. Molinar. Thank you very much for repeating that line, too. We just need to sink in on that. Luella Coffer, Senior Department Administrator of Human Services, Hennepin County.
Thank you, Chair Hoffman, members of the committee. As you mentioned, my name is Luella Coffer, and I'm the Senior Department Administrator for Access, Aging, and Disabilities in Hennepin County. I'm here testifying on behalf of Hennepin County and the communities we serve. Thank you for this opportunity. Today, my focus is on some potential impacts of several of the measures to control disability waiver growth and proposed disability waivers cost shifts. According to the state's LTSS demographic dashboard, Hennepin County has increased the number of people accessing all home and community-based services by 16.6% from 2019 to 2023, while the number of people receiving services in an institutional setting decreased by 21.2%. Our greatest percentage increases have been in the groups under age 24. As I listen to experiences of those we serve, I often hear hope, but also desperation, worry, and exhaustion. We've layered one thing after another on our system, typically in the vein of simplification, flexibility, or fixing something that isn't working well. It's a lot to try and navigate. When I listen to the experience of our staff, I hear similar things: worry for the people we're supporting and frustration. Burdensome, albeit well-intended efforts have not made it easier to support people who use services. Starting with the proposals for rate exception and input monitoring measures and the potential impact for people who depend on our services. Some of the proposed measures increase documentation requirements. Sounds good and possibly necessary. In practice, that may mean that people continue to experience a delay in access to services while provider rates are set, a current pain point in our system. Providers may continue to decline to serve people who have complex needs that aren't easily translated into appropriate service and rate categories. The proposal to cap inflationary adjustments will likely impact the ability to attract and retain quality direct care workers. This makes our work more challenging to find providers to support people, and quality of direct services impacts complaints that case managers need to monitor and address. There are proposed measures to limit billing and access for certain residential services. These proposals continue to push the system to build out services that can be delivered in a person's own home. Philosophically, a good thing. At the same time, really challenging in practice, given workforce shortages, lack of accessible, affordable housing, and complex needs. In Hennepin County, residential services measures could impact our efforts with unhoused individuals and with hospital transitions. Within the residential services proposals, there's the new 5% county share for residential services under the disability waivers. In Hennepin County, this county share is projected to be about $20 million annually. This measure will have real impact. Shifting these costs means property tax increases. It's a tough conversation, as folks have said, with no simple solutions. I'm engaged in discussions on ways to preserve quality services and reduce administrative burdens and lower system costs. Happy to continue to be part of those conversations. People with disabilities in Hennepin County deserve to have the same quality of life as other residents. Thank you again for your time, and happy to answer questions.
Thank you, Luella. Well, I think we're going to be the next group, too. I think we'll have time to have the conversation. If not, then a follow-up. What would Diane Dodge say? Nicole Hansen, speaking of by Beltrami, you're just 2 counties away by Beltrami County, Otter Tail County, so the mic is yours.
Thank you, Mr. Chair and members of the committee. I am Nicole Hansen. I am the County Administrator of Otter Tail County. I am here in partnership with the Association of Minnesota Counties and the Minnesota Intercounty Association. Thank you for the opportunity today to talk with you about how counties can best partner with the state to deliver services and programs that are essential to our communities and residents, while also sharing our concerns about the governor's proposed budget cost shifts. Otter Tail County is located in west central part of Minnesota and has a population of just over 60,000 residents. It is a large geographic county of over 2,225 square miles with 22 cities, 62 townships, and 1,048 lakes, and we are represented in the Senate by Senator Rasmussen. While Otter Tail County boasts many amenities and is supported by a strong economy, roughly 10% of our residents live in poverty and will be impacted by cost shifts, either directly as property owners or indirectly as renters with increases to property taxes. Additionally, when the county reviews our budget annually and we talk about delivering the program and the services that we need to support through our funding, we're also mindful that property owners may be impacted by property tax increases to other local government, cities, townships, as well as school districts. Just to highlight a few of the proposed cost shifts, one of them is the 5% cost shift for disability waiver services, which would cost Otter Tail County over $800,000. The Minnesota Sex Offender Program, shifting that to a 40% cost, will cost Otter Tail an additional almost $845,000. As far as the substance use disorder, changing that to a 27% cost shift and revenue decrease will cost the county $143,000. The total proposed cost shifts that I'm talking to you about here today is projected to be almost $1.8 million. This equates to over 3% of Otter Tail County's budget levy for 2025. And I want to highlight that Otter Tail is one county, so I hope other counties are talking with you about their increases as well, because it does vary across county. I also wanted to bring up that while we're focused on the Department of Human Services budget today, there are other cost shifts or costs that will be coming to the county with either past legislation that we're trying to monitor, as well as reduction in aid, which we are already receiving through the EAS aid or the cannabis local government aid. I'll highlight two here today. One of them is the the Minnesota Paid Family and Medical Leave Act, as well as the Minnesota African American Family Preservation and Child Welfare Disproportionately Act, both which are important programs for our workforce and our families, but do need to be included in the county budgets. The PFML is expected to be around a $200,000 increase if we use today's dollars and splitting that 50-50 with employees. And the African American Family Preservation Act is projected to cost between $1.2 and $1.9 million. Again, this program is important and historic, but the costs alone underscore the need for the legislature to take further review on the implementation and current lack of state support if this is to be successful. Minnesota has been effective in providing services to those in need through a delivery system that is set by the state and administered by counties to ensure that all residents receive needed services regardless of where they live. The current system has been working and providing these critical services to those who need them the most. Counties are more than willing to work with DHS to find solutions to control the costs that do not involve cost shifts. In closing, I want to thank you for your time at this committee and your willingness to hear from counties when making these very difficult decisions in your leadership roles. Thank you, Mr. Chair and committee members.
Thank you, Ms. Hansen. Next, and then Julie, before you get started, Kyle Byrne, Aaron Hubbard, Annalise Peterson, and Amy Meineke, those two are on Zoom. John Lynn and Callie Blazer. I think we have, we'll have it. You guys will be able to come around. But if you guys could stick around, I think if we have some time afterward, this committee, we're going to have a little conversation afterwards. And if there's any questions from members, I know some were ready to raise their hand and do it. So, Ms. Jepson from Anoka County, welcome to the committee.
Thank you, Mr. Chair, and thank you, Senators, for inviting all of us here today. My name is Julie Jepson. I'm an Anoka County Commissioner, and I don't really know what else additional I can say today that these ladies and gentlemen have already explained to you. But like you, I'm an elected official with a hot mic, and so I'm going to take some opportunity to speak my truth in front of you today. So when I introduce myself as a county commissioner, 9 times out of 10 people say, I am so sorry, I'm embarrassed to tell you this, but what does a county commissioner do? This is what a county commissioner does. 1/3 of our budget goes to the sheriff's office. 1/3 of our budget goes to general government, libraries, licenses, and passports, courts, jails, things like that. But 1/3 of our budget goes to human services. For Anoka County, you've heard a lot of numbers today. For Anoka County, we spend over $140 million a year on human services. And since the governor's budget was released, we've gone through feelings of shock, anger, frustration, betrayal, and confusion. The governor's cost shifting is packaged and presented as an alleviation of the state's budgetary pressures, when in fact, the expenses are still there. They're just hidden by shifting the financial responsibility of millions upon millions of dollars onto counties. It avoids fixing an overburdened, dysfunctional, unsustainable system. It is a slap in the face to counties that do the work you demand of us, and implies that counties have been ineffective thus far in our oversight and management of our resources. We've seen year after year, with no end in sight, that the funds needed for human services are only increasing because the needs are increasing. The needs of people who need help, the intensity of that need, costs for providing those services, all while simultaneously a decreasing workforce. Rather than proposing any meaningful, systematic changes which will inherently save taxpayer dollars, you continue to mandate, not you, collective you, governor you, continue to mandate that we do more with less, wrapping it in a bow and telling us it's a good thing. Why, you might ask? Because it's easy. It's the easy thing to do. It's the easy way out, but don't be fooled. These are not reductions in expenditures that we're talking about. This is shirking of your responsibilities onto the county, and that's not okay. You haven't listened to us. You haven't collaborated with us in understanding the true scope of our work. You haven't invited us to the table. As that testifier so eloquently said, we are begging for a seat at the table to help you solve this. Because we want to be with you. We want to find real solutions to a very complex system. It is also a direct burden on our constituents and our businesses. As these ladies alluded to, it is a direct reflection on our property taxes. Just to give you some idea, the best stable strategy for county government to levy dollars annually is a continual about 2 to 4% each year, depending on inflation, depending on needs, depending on programs. This for Anoka County will add a baseline, add 5% to our levy. You've heard a number of numbers thrown around, but 5% baseline, and that's on the known programs. That is not on the unknown that you, Nicole, just mentioned before. So counties cannot afford to sustain this. Individuals and businesses cannot afford to sustain this. So I'm here to tell you today that enough is enough. We're done, all right? We're done with the cost sharing. We need to come together to figure this out. We cannot continue to be handed your responsibility like a hot potato, expecting to provide services for an increasing population of individuals with a decreasing workforce. We can't do it anymore. Today, I'm asking you to be brave. I'm asking you to do the hard things. I'm asking you to listen to us and to join us in fixing this broken, unsustainable system. Thank you very much.
Thank you, Madam Commissioner. And you guys are going to stick around. I think we're going to be okay. If you could make room, we'll get Aaron. Kyle, you got Kyle, Aaron, Annalise, and Amy on Zoom. John Lynn and tally. Is that correct?
Mr. Chair?
Yes, Senator.
Oh, well, they're all changing. So when they come back, there's like so many numbers I can barely keep track, but could each county kind of do a composite, like what percents are going to be on their property tax? Like just, that would be helpful to me. I think Anoka County said 5, but is that 5 in the next 2 years? I know it goes up in the out years. So if they could just report that, that would be helpful. And I'm trying not to comment. That's just a question. Thank you.
No, that's awesome. That was the promise we made to one another. We're not commenting, we're questioning. It would be nice to get Matt Freeman up here. Maybe he knows exactly all the numbers that are there. Well, I see you guys didn't think I would not do it today, but I did. Kyle, you starting us off here?
That's right.
Thank you.
Thank you, Mr. Chair and members. My name is Kyle Burnt. I'm here today on behalf of the Long-Term Care Imperative. I'm going to focus my comments to the governor's nursing home cuts, and my colleague will finish us off with the long-term care testimony. Since 2020, more than 3,100 nursing home beds have been taken out of service statewide. This includes 29 nursing home closures that have happened in greater Minnesota, impacting access in those local communities. This governor's budget places a 2% cap on all future rate increases, limits health insurance coverage for our employees, and ends planned closure rate agreements and single bed incentives. The proposed cut of $218 million over 4 years cuts deeper than the top line would appear. As members may remember, a cut to Medicaid results in less from the federal share as well as private pay due to rate equalization. In total, nursing homes will see an estimated cut of $700 million. In the 9 years prior to the value-based reimbursement model, caregiver raises rose 12.5%. In the 9 years since implementation, caregiver wages have risen nearly 70%. Even with these improvements, our nursing facilities are still facing significant job vacancies for critical caregiving and nursing roles, and this is a workforce challenge that is driving the closures and bed layaways. Also in the governor's budget is $15 million to pay for the Nursing Home Workforce Standard Board minimum wage and holiday pay standards. However, we estimate that these standards will cost nursing homes $200 million. The budget proposal simply does not pay for the requirements of the board. As a reminder, since we are early here in session still, the forecasted increases reflect past payment, not future money. This is because the system has a 15 to 24-month lag to update reimbursement rates. The forecast reflects projected growth based on past expenditures. It is not an infusion of new money to help give our hardworking workforce a raise. We are coming out of a pandemic that decimated our workforce, our reserves, in the spirit of many of our caregivers. It was not so long ago that staffing shortages were so severe that the governor had to call up the National Guard to staff our facilities. Mandates for a higher wage for employees and taking away funding at the same time, put simply, it doesn't add up. The governor's budget results in Minnesota's 340 nursing homes facing a $900 million gap and undermines the VBR model, which has increased wages for our employees and helped stabilize our workforce. This proposal uses nursing homes to balance the budget and puts nursing homes at further risk of closures. We ask legislators to ensure there are no cuts to Minnesota seniors this year. And to Aaron. Thank you, Mr. Chair and members.
Kyle, you did that in 2 minutes and 40 seconds. Efficiency of a former Senate staffer. Aaron, and then we'll go to Annalise and Amy then on Zoom. I'm just going in order that you guys, so it's all yours, Aaron.
Thank you, Mr. Chair and members of the committee. For the record, my name is Erin Hubert, and I am also with the Long-Term Care Imperative. So in addition to the items that my colleague just discussed, I would draw your attention to a few other concerns in the governor's proposed budget. The DHS budget acknowledges that elderly waiver, which is the primary way that low-income seniors access services like assisted living, home care, or adult day, does not have any sort of inflation factor. And while he may characterize that as a plus, I would just acknowledge that has real consequences. It means that rates would not increase at all, even if costs go up for a variety of reasons, including the compensation of staff or their healthcare benefits. It is also why we would share the concerns articulated today by others about the cuts to disability waivered services. Switching gears, the MDH budget proposes a significant increase in fees to our assisted living providers. We already have a severe affordability crisis, especially for middle-income Minnesotans, and this will not alleviate that problem. I would like to be specific about one item in the budget that my colleague just referenced, and that is the 2% cap on the operating rate for nursing homes. Let's be really clear about what that is. The operating rate pays for the food that residents eat. It pays for the activities that they enjoy. It pays for the wages of the nursing staff, the housekeeping staff, and the dietary aides. So this proposed cut is bad for seniors and it is bad for workers. The long-term care imperative did research in December of 2023 to get a sense of Minnesotans' values and expectations for senior care. More than 4 in 5 Minnesotans believed that seniors have a right to housing, care, and support. 79% believe that the state is not prepared for the aging boom, and 88% of rural Minnesotans expect care within 30 to 40 minutes of their home community. The budget proposed by Governor Walz fails to meet those expectations. The aging boom is now here. Cutting services and hiking up fees is not helpful to seniors and their families. And this proposal will deepen the crisis in rural care. So again, we oppose cuts to seniors and ask that you do too. Thank you.
Annalise Peterson, are you still with us?
Yes, I am.
Zoomland, it's all yours.
All right. Good afternoon, Chair Hoffman and the members of the Senate Human Services Committee. My name is Annalisa Peterson. I'm the Chief Operating Officer for Benedictine, a Catholic nonprofit organization with 22 assisted living facilities and 16 skilled nursing facilities in the state of Minnesota. We own and operate communities in rural northwestern Minnesota, such as Ada and Crookston, communities in central Minnesota, the metro, and into southeastern Minnesota. More importantly, I'm also a daughter and a daughter-in-law of aging parents. As a provider, I understand the financial impacts of the governor's proposed budget, but as a daughter-in-law, I worry about the effects that this will have on my in-laws specifically, both living on fixed incomes, receiving support from elderly waiver services, with potential needs for future skilled nursing care. My father-in-law is in the hospital as we speak, and I believe that care will be near. Finding care for older adults in their home communities is increasingly difficult. As proposed by Governor Walz's, a 2% cap on operating rate increases will put a strain on the facility's ability to keep up with rising operational costs, leading to potential service cuts or even closures. For our organization alone, we invested over $6.5 million in wages, food, activities for our residents, and other needs from October of 23 to September of 24. Again, those expenses are already paid. And under the proposal, we will not see $4.4 million of the $6.5 million in our 2026 rate. The removal of the closure of rate adjustments, single bed incentives, and layaways will lead to closures of facilities that are already operating at a loss, causing disruption to care for seniors and forcing workers into unstable employment situations. For Benedictine, this proposal results in an additional $3.9 million loss. Finally, the estimated costs of the Minnesota Workforce Standards Board mandates were never studied prior to the board rules being finalized, despite the 3 providers on the board requesting this over and over again. The current estimates by the state are wholly underestimated and do not account for the real impacts. For Benedictine, we are already seeing significant increases just 2 holidays into this new standard. We will need to add 5 holidays, and the cost for the organization is over $1.6 million. There are people on the Workforce Standards Board that thought this impact would be minimal. I don't think $1.6 million is minimal. For our organization, the wage increase recommendations by the Workforce Standards Board will be well over $1 million in the first year and escalate significantly in the second year. The grand total for the Workforce Standards Board recommendations are over $5 million at Benedictine for only 16 nursing homes. Yet the governor's budget puts virtually nothing in this biennium and $15 million in the next biennium to cover all 350 nursing homes. The governor's proposed results in a total of $12.9 million in unreimbursed costs for just 16 nursing homes in one organization. In conclusion, I urge the committee to consider the full effects of the cuts will have on our community and the people we serve. Thank you for your time.
Amy Meineke.
Good afternoon, Mr. Chair and the members of the committee. My name is Amy Meineke, and I serve as the Executive Director at the residence at Northridge. And I'm here today on behalf of Mission Health and want to express our deep concerns regarding the governor's proposed budget. We are a 500 plus continuum of care campus, the largest in the metropolitan area, and we employ over 300 staff. We strive to provide quality care for our residents, and as you can see, the long-term care funding affects us greatly. This budget threatens the integrity of the Minnesota value-based reimbursement model, a system that has enabled providers to offer competitive wages and benefits to caregivers. But reverting to a flat percentage based increase, we risk repeating past mistakes. When a caregiver wages fail, it fails to keep pace with inflammation. Since the implementation of BR, I have been able to provide consistent wage increases for our dedicated staff, improving their financial stability. This has enhanced the healthcare coverage that we offer our employees, a benefit that's now at risk due to the proposed budget caps. The budget proposal includes $700 million in cuts to nursing homes over the next 4 years. This is a devastating reduction at the time when the baby boomer generation is reaching the age of 80. We are seeing more people stay home longer and waiting to come into nursing homes and assisted livings, in turn needing higher care, which is requiring more funding to give them the quality of care they deserve. Now is not the time to step back for Minnesota seniors. Instead, we must prioritize the investments in long-term care. Compounding these funding cuts are now unfunded mandates imposed by the Nursing Home Workforce Standards Boards. These mandates will place additional strain on the nursing facilities already operating on a thin margin, and not willing to compromise our standards of care. Reimbursement rates are lagging from 15 to 27 months behind expenses without immediate funding, and this is leaving a financial burden that's just unsustainable. A budget that leaves nursing homes with a $900 million funding gap offers operators new options and jeopardizes the quality of care for seniors and places and pressure already strained on our workers. The COVID-19 pandemic was one of the most challenging crises our industries have faced, and we battled inflation and staff burnout. Now, as we move forward, we need a strong leadership and clear vision to ensure Minnesota's growing senior population. I'm urging the community to please reject the budget proposal, and I want to thank you for your time and consideration and for hearing me out today.
Thank you, Ms. Meineke, and say hi to Ann Rest for me, will you? Make sure thank you. John Lynn and Collie Blazer, you're in front of us. John, you go first.
Oh,
welcome.
Mr. Chair and members of the committee, my name is John Lynn, and I serve as the Regional Executive Director for Ecumen St. Benedict's up in St. Cloud. Ecumen is a nonprofit organization serving older adults across Minnesota through skilled nursing, assisted living, memory care, home care, and hospice. I appreciate the opportunity to share my concerns regarding the governor's budget proposal and its impact on Minnesota's long-term care facilities. According to the Center for Rural Policy and Development, 33% of rural nursing home beds have disappeared in the last 20 years, with more at risk. With the equalization of private pay rates and the loss of a federal match, the governor's proposal will cut $700 million from Minnesota's nursing homes. This will further limit access to care in rural communities and will accelerate the crisis that's unfolding for our state's older adults. The caregivers I work with deserve a raise. Due to rate equalization, nursing homes are unable to raise prices. Instead, the only way to provide a more substantial raise is through legislative appropriation. This is why I'm deeply disappointed that the governor's budget allocates only $50 million to cover the $200 million in costs associated with the mandates imposed by the Nursing Home Workforce Standards Board, a board whose members are appointed by the governor. These unfunded mandates enacted without legislative approval place a significant financial burden on nursing homes. The board recently imposed two major unfunded mandates. One, a requirement to pay 150% of wages for 11 holidays, which the long-term care imperative estimates will cost each nursing home at least $25,000 annually. A minimum wage increase for nursing home workers set to take effect in 2026, with further increases in 2027. The governor's proposed $15 million allocation covers less than 10% of these costs, leaving skilled nursing communities with an impossible funding gap when combined with a $700 million cut. This shortfall threatens the viability of nursing homes across the state, especially in rural areas where providers already face staffing shortages and financial strain. The actions of this unelected board could cause irreparable harm to access to care in Minnesota's rural communities. If the governor's appointees impose costly mandates, those mandates should be fully funded in this budget. We agree with the governor that Minnesota should be a great place for families, but it can only be a great place for families if it includes all of our family members. A budget that prioritizes stability, sustainability, and access to quality care for older adults is one that supports Minnesota families. I urge this committee to reject harmful cuts, fully fund the board mandates, and ensure that decisions impacting nursing homes undergo proper legislative review. Thank you for your time and consideration.
Thank you, Mr. Lynn. Callie Blazer, welcome.
Hello. My name is Kaylee Blazer, and I serve as the administrator at the Good Samaritan Society Specialty Care Community in Robbinsdale. The Robbinsdale location is a specialty care community which serves those with special care needs, including post-acute rehab, Huntington's disease, and a behavioral memory care. With 1 in 4 Minnesotans projected to be age 65 or older by the year 2030 and a 70% likelihood of needing long-term care, the governor's budget undermines our responsibility to support an aging population. The proposal effectively results in a $700 million in cuts to nursing homes when considering rate equalization of private pay rates and the loss of federal matching funds. Such reductions will put a strain on facilities such as mine, who provide a unique and nationally recognized service in our community. The value-based reimbursement payment reform enacted in 2015 has been instrumental in stabilizing the long-term care workforce. Over the last 9 years, VBR has increased caregiver wages in Minnesota by nearly 70%, while also expanding access to health insurance and other benefits. These improvements have strengthened our workforce, ensuring that caregivers receive the support they need to provide high-quality care to Minnesotans. Rolling back this progress through a 2% rate cap would be a step in the wrong direction. This budget proposal contradicts the commitment we have made to ensure Minnesotans can age with dignity in their communities by receiving appropriate care. Our state budget should reflect our values and priorities. Cutting funding for long-term care disregards the dignity and well-being of our most vulnerable residents, making this proposal unacceptable. I urge this committee to reject these harmful cuts and instead advance policies that uphold Minnesota's commitment to its long-term care population. Thank you, Mr. Chair and members, for your time and consideration.
Thank you. Members, that ends the folks. We did that in record timing today, and there's a ton of information that was in front of us. Thank you. Senator Rasmussen.
Thank you, Mr. Chair, and I just appreciate all the testifiers who came today to be a part of this conversation, and I hope, Mr. Chair, the governor's office is listening as well, as we look towards the February forecast and continuing the conversations over budgets. And I think we heard here today what this means for Minnesotans. I just had a letter here. One of our testifiers runs social services department for Traverse County, which is one of the counties I represented. And I'll make sure that members of the committee get a copy of this letter. But the estimated annual cost shifts to Traverse County just on an annual basis is about $395,000 in the governor's budget. Now, I looked up on the U.S. Census Bureau, estimates that there's about 1,400 households in Traverse County. So this would be a $280 property tax increase per year on every single household, just with the cost shifts in this budget. And so I think we have to, listen to the stories we heard today, look at the numbers, look at the math, and work to find a better way to solve the budget issues that the state is facing.
Senator McQuaid, to that point, because I also heard people saying they want to be at the table with us, helping us. So Senator McQuaid.
Oh, thank you, Mr. Chair, and I agree. I mean, I hope, I always say that I wish the media would come and cover this committee because it's some of the most important work that happens in the legislature, but just because we're not fighting doesn't mean it's not important. And I was listening and I heard, and I think one of the things that I just want to make sure we say is that when we approach structural deficits, for some reason, the only thing we think about is what services are we cutting? We never think about who is not paying their fair share to make sure that people can still have the things that they need. And Senator Rasmussen shared with me a helpful chart that shows kind of the shift from state costs to counties, about $460 million. I did a little back of the napkin math, Mr. Chair.
Is your mathing then?
It is. I'm doing math in public, which I tend not to do, but I did it privately before I'm sharing it publicly. If we had regular sales and use tax on airplane parts, data center equipment, and preferred athletic seating, we could get $162 million. You add in, and now my lack of business degree is going to show, but dividend received reductions, you get to almost $460 million. Really? Yeah. So before we start, I don't know, it's so that corporations don't get triple taxed, which, okay. I guess what I was saying is I'd rather have corporations pay taxes and have airlines pay taxes for their airplane parts before I take away nursing homes and services for people with disabilities. And so we have to open up the conversation to stop trying to think about like the best way to strategically cut services, because that money isn't here. I mean, it is if we want to hurt people, but the people who aren't paying in right now, they're also hurting people. They're the ones who are forcing us to have this conversation about, is my kid going to have services tomorrow? Are we going to have respite care? All that kind of stuff. And we can have a different kind of conversation. I'm really interested in that conversation. I don't want to shift costs to counties. I don't want to cut services for people. I do want the people in the state who have the most to pay their fair share so that we can all have the things we like.
Thank you. This is great, this committee. We have this multiple conversation happening, but to those points, I like that's what we're going to be at the table, right? We're going to go to Glenn and then to Jim. And yes, Jim, I'm not going to go back 10 years ago. Forget it. We're just going to go. Glenn, go ahead. I'm going to stay quiet, Glenn. How do you like that one? Glenn, you're next.
Okay. Yeah. Hey, thank you, Mr. Chairman. Yeah, I just want to thank the testifiers too. And for the record, I don't support the governor's budget. Okay. But a couple things that struck me. That Nursing Home Standards Board is evidently passing a lot of unfunded mandates onto our nursing homes. Number one, I think those should be repealed. And of course, I'd have to review them. But do we need a Nursing Home Standards Board? Don't we have HHS and local county people that oversee that? Plus, I know the nursing home manager or CEOs or whatever in my district, and they care more about the patients than I think most state bureaucrats do, to tell you the truth. I do think that your analogy, Mr. Chair, where we're getting 65% of the cuts when we're 25% of the budget is well placed. It seems like we're being discriminated against. And I think that needs to be brought back in balance.
Thank you.
So we have an area of agreement.
Imagine that. Glenn Grunhagen and John Hoffman agree on one thing. That's pretty good.
Well, we agree with more than that. But the other thing to understand, members, and when you grow government in the last biennium at 40% in one biennium, okay, there is no way for the private sector to generate the tax revenues to keep up with that, okay? You've got to grow. Government is an expense on the private sector. You need to grow government at a rate that balances with the private sector's ability. And when we grow government at that rate, and raise taxes another 9 to 10 billion, you know what happens? Some of the most successful people, and this is documented, leave the state. I lost a business that was actually part of my insurance company or agency. They figured with their, it was a small to mid-sized business, they figured with their tax accountant that if they went to South Dakota, they'd save $12 million in the next 10 to 11 years. So guess what?
Bring us home, Glenn.
They're gone. So we've got to bring this in balance.
Okay.
We've got to bring our reductions in balance with the rest of the budget. And there's a number of areas that are being untouched in the governor's budget. And I think we need to look strongly at getting rid of unfunded mandates. I've already lost 2 nursing homes in my district in the last several years, one last year.
Yeah, Arlington.
So.
Yep, thank you. Thank you. Thank you to that. Senator Abler.
You know, I didn't think I would enjoy today, and I didn't. Sitting on this committee, if you have any kind of a heart or emotions or compassion at all, it's a horrible committee to be on.
Yeah.
Because just the perils that we sit through with families and the seniors and all the challenges, and the people in this room are largely committed to serving those individuals. And on a good day, Mr. Chair, we get to find out, oh, hey, we're going to add home services for respite care. Yay. You know, it's like, and then, but on days like today when it's just like the other way, it's really hard. And so I'm struck by the desire of some people to be at the table. And, you know, we've made a careful point not to, you know, impugn the DHS staff sitting in the corner up there. They're merely the messengers.
Correct.
But I do not know who the architect of this is. But I wish they would come and tell us how this is supposed to work. I wish they would come and talk to the parents who are watching at home and the counties and the people, like, how is this supposed to work? Yeah. How is this supposed to work? And so we have a lot of work ahead of us, and but I just want to put out my own plea. And when we were doing this under my gavel, people made fun of me for looking at the details. So there's a 4-year thing, but then there's a 6 and 8 year thing, and we would always look to see what's it going to be. And sometimes we fought to get more spending in the details to help serve the very needs that we've heard so much about. And none of that is wasted. Senator Hoffman, you helped me. You were my conspirator in getting some money that we knew that would be necessary going forward. And so I don't apologize for that.
No.
But we need to find a way to make it go well. And so the people that want to be at the table, come to my table, come to Senator Hoffman's table and Rasmussen and the rest of us. But particularly, I'm trying to find ways that we can find ways to take the money, make it go further. And I'm going to cry, so I'm going to stop. Thank you, Mr. Chair.
No, it's going to take all of us. Senator Utke, and then if members are okay, the county commissioner from Anoka is at the table. So Senator Utke.
Thank you, Mr. Chair, and thank you to all those that joined us here today and told their stories and testified, because honestly, it's things we've all been talking about, but we hear it right from those that are affected on a daily basis, and sure appreciate that. But I think it's plain and simple, Mr. Chair. Package this budget back up and return to sender and tell them we want it back with a serious proposal. So that's it. Make it simple. Thank you.
Return to sender. I started, why did that song go in my head on that one? But this is why we exist, you know, we get to the why. Listening to people, we get to the why. That was pretty good, wasn't it? That was good. Before I make some final comments, Commissioner, you want to take us home? We got about 30 seconds. So
Thank you, Mr. Chair. I just want to be very clear that this is a deeply damaged, broken system. And I so appreciate your comments about finding new dollars to put towards this. No one is ever going to turn dollars away. Absolutely never. But at the heart of this, we are in a pivotal opportunity here to work nonpartisan, bipartisan on a terrible idea and start over.
Amen.
And that's where I'm coming at. Let's fix this before we continue to throw money at. But before we continue to take money away. So two very simple things that don't cost a penny but will be revolutionary to the system, back to Senator Abler's comments, is that it takes 14 hours for one person to do an assessment on one person. 14 hours. It is required of us to do an annual review of that assessment, which takes 10 hours of one person's time to do one person's reassessment. That is dysfunction at its finest. I mean, if we simply change that, and those are for people whose medical needs and their disability needs will never change, will never change. Okay, so if we simply change that annual review to every 3 years, there's a problem solved.
There you go. What's the second? All the way from Anoka County.
The second one is, another interesting thing, is if we determine eligibility for medical assistance before the Min Choices assessment, that is time saved, that is timelines adjusted. Right now, Min Choices assessment has to be done prior to medical assistance eligibility. But you can only get Min Choices, if you're only eligible for Min Choice, if you're eligible for medical assistance. It's totally backwards. And people are put in this netherworld of waiting for bureaucracy, waiting for approvals, and things just get so discombobulated. If you change medical assistance approval before Min Choices, that is the solution.
Thank you. I love this. You know, it reminds me, thank you everybody for taking time today to do this. And Luella, that attitude reminds me of this woman named Diane Dodge. Do you remember that name? I hope she's still with us. Diane Dodge was this social worker in Hennepin County that would uncover every little rock, there was never, you can't, I can't do it. She was, and I don't know, just said that thank you for being here, because it reminds me, I kind of said, what would Diane Dodge do in this situation? She'd go find an answer, find a solution, right? You know, and so I think with that, members, we're gonna, there's some notes being taken here, but to what the commissioner said, and everybody, thank you for coming in and being authentic about the reality that's in front of us. We do need your help. You're the experts. Bring us solutions, right? Senator Abler, I remember you saying this a few years ago. You have the answers. Bring the solutions to us. And so we're all of us on here, from Aaron McQuaid all the way down to Senator Wickland and Utke, everybody here, Senator Rasmussen, just, you know, seek us out. And we're going to seek you out. The table is here in front of us, and I think we're going to do some kind of more work on this. We got to get to work on this, and I appreciate everybody's bringing the stories and bringing the reality that's in front of us. So I'm in it, ready to get to work. Thank you, everybody. We are adjourned.